Have you ever wondered why tuberculosis, a disease as old as human civilization, continues to affect millions of people worldwide? A question that leaves us pondering, doesn't it? Tuberculosis, often shortened to TB, is an enduring mystery, a paradox of the medical world. It's a disease that has haunted humanity for centuries, leaving its mark on every epoch of our history, from the mummies of ancient Egypt to the medieval European societies. And even in the annals of our contemporary world, tuberculosis has been a persistent companion. Today, the disease remains a global health challenge of staggering proportions. It's estimated that roughly 1/4 of the world's population is infected with the TB bacteria. Yes, you heard it right, 1/4. Despite the monumental advancements in our understanding and treatment of diseases, tuberculosis continues to be a formidable adversary. The battle against tuberculosis is not just about medicine, it's also about unraveling the complex web of social, economic, and environmental factors that contribute to its spread. It's about understanding how the disease works, not just at the biological level, but also at the level of communities and societies. And that's precisely what we're going to do in this video. We're going to embark on a journey into the world of tuberculosis. We'll explore its history, its biology, its impact on human societies, and the efforts being made to combat it. From its microscopic origins to its global implications, we'll delve into every aspect of tuberculosis with the aim to educate, to inform, and to inspire a greater understanding of this ancient enemy. But why should we care? Because knowledge is the first step towards action, because understanding tuberculosis can help us fight it more effectively, and because every single life saved from this disease is a victory for humanity. So, are you ready to join us on this journey? Are you ready to unravel the mystery that is tuberculosis? Stay tuned as we delve deeper into the world of tuberculosis. Tuberculosis, often referred to as TB, might sound like a complex term, but what does it really mean? Well, let's break it down. Tuberculosis is a bacterial infection caused by a microorganism known as Mycobacterium tuberculosis. Now that's quite a mouthful, isn't it? But let's not get bogged down by the name. This little bacterium is the culprit behind the disease we know as TB. But where does it strike? Primarily, tuberculosis targets the lungs. That's right, it's a respiratory disease at heart. However, don't be fooled into thinking that it restricts itself to just one area. This bacterium is a bit of a wanderer and can affect other parts of the body as well. It can spread to the kidneys, spine, and even the brain. This ability to impact various organs is what makes TB a systemic disease, meaning it can affect the body as a whole. Now, you might be wondering, how does this bacterium cause disease? Well, once the Mycobacterium tuberculosis enters the body, it begins to multiply and invade the tissues. It can cause a condition known as granulomas, which are small areas of inflammation in the tissue where the body has tried to wall off the bacteria. These can eventually break down, allowing the bacteria to spread and potentially causing significant damage. But here's the kicker. Not everyone who is infected with Mycobacterium tuberculosis gets sick. Some people can carry the bacterium in a dormant state with no symptoms at all. This is known as latent TB, and while it's not contagious, it can become active TB if not treated. So, in essence, tuberculosis is a potentially serious infectious disease that primarily affects your lungs but can also spread to other parts of your body. It's caused by a bacterium that can lie dormant in your body and can reactivate if your immune system is weakened. Now that we know what tuberculosis is, let's explore how it spreads. How does a disease that sounds so distant touch so many lives across the globe? The answer lies in the fact that tuberculosis, often abbreviated as TB, is an airborne disease. It doesn't need a plane ticket or a passport to travel. It simply rides on the air we breathe. When a person with active TB coughs, sneezes, or even talks, they release tiny droplets that contain the bacterium Mycobacterium tuberculosis. These droplets can linger in the air for hours, ready to be inhaled by anyone who happens to pass by. This ease of transmission is what makes tuberculosis such a widespread disease. But here's where it gets interesting. Not everyone who inhales the TB bacterium will get sick. Instead, they may develop what's known as latent TB. In this state, the bacteria remain in your body in an inactive form, causing no symptoms. You're not infectious and can't spread the bacteria to others. However, if your immune system weakens, the bacteria can become active and you can develop TB disease. Active TB is a different story altogether. It's a serious condition that can affect various parts of the body, but it primarily targets the lungs. People with active TB are infectious and can spread the disease to others. The symptoms can range from a persistent cough and weight loss to night sweats and fever. This is why it's crucial to understand the difference between latent and active TB. It's not just about knowing the medical terminology, but about understanding the implications. A person with latent TB can live a normal life without any symptoms, but they carry the potential to develop active TB, especially if their immune system is compromised. The journey of tuberculosis is a fascinating one, from a single cough that releases the bacteria into the air, to the lungs of a passerby, and potentially to an active disease that affects thousands of lives worldwide. Understanding how tuberculosis spreads helps us better comprehend its symptoms. It also underscores the importance of early detection and treatment, not just for the individual affected, but for the health of communities worldwide. How do you know if you have tuberculosis? What signs should you look for? Tuberculosis, often known as TB, can be a bit of a chameleon. Its symptoms often mimic those of other common illnesses, making it somewhat difficult to detect. However, there are some telltale signs that might suggest you're dealing with more than just a stubborn cold. A persistent cough is one of the most common symptoms of tuberculosis. This isn't your average clear up in a few days kind of cough. We're talking about a cough that sticks around for 3 weeks or more, often producing a thick, cloudy mucus. In severe cases, this mucus may even be streaked with blood, a sign that the infection is causing damage to your lungs. But a cough isn't the only symptom you should be aware of. Tuberculosis often brings on a fever, a body's natural response to infection. This fever can be low-grade, just enough to make you feel a little off, or it can be high, leaving you bedridden and feeling very unwell. Night sweats are another symptom that shouldn't be ignored. These aren't just a little extra perspiration, we're talking about drenching sweats that can leave your bedsheets soaked even in a cool room. Weight loss is also a common symptom of tuberculosis. This isn't the kind of weight loss you might see from a new diet or exercise routine. It's unexplained, often rapid, and can be accompanied by a loss of appetite. Now, these symptoms are most common when TB affects the lungs, which is most often the case, but tuberculosis can affect other parts of the body too. Depending on which area is affected, the symptoms might vary. For example, TB in the spine may cause back pain, while TB in the kidneys might lead to blood in the urine. Recognizing these symptoms is the first step towards diagnosis and treatment. So, if you or someone you know is experiencing any of these symptoms, it's important to seek medical advice straight away. Yes, tuberculosis is a serious disease, but remember, it's also treatable. The earlier it's caught, the better the outcome can be. Knowing the symptoms is one thing, but how do medical professionals confirm a tuberculosis diagnosis? Well, it's a process that involves multiple steps and various tests, all designed to ensure an accurate diagnosis. One of the most common methods is the tuberculin skin test, also known as the Mantoux test. Here, a small amount of a substance called PPD tuberculin is injected into the skin on the lower arm. If a raised bump develops on the skin within 48 to 72 hours, it could indicate a TB infection. However, the skin test isn't foolproof. Some people may not react to the test despite having TB, while others may react despite not having the disease. That's why blood tests are often used in conjunction with the skin test. These tests measure the immune system's response to the bacteria that causes TB. And then there are imaging tests. A chest X-ray is often the first imaging test used to help diagnose TB. This test can show whether there are any abnormalities in the lungs that might be indicative of tuberculosis. For example, the presence of nodules, cavities, or certain types of lung inflammation can suggest TB. But that's not all. In some cases, especially when the disease is advanced, a CT scan may be used. This test provides more detailed images of the lungs and can help identify TB in its early stages when it's not easily visible on a chest X-ray. Keep in mind, The type and combination of tests used to diagnose TB can vary depending on the individual's health status and the progression of the disease. For instance, those with weakened immune systems, such as people with HIV, might require more extensive testing. So as you can see, diagnosing tuberculosis isn't a one-size-fits-all process. It requires a careful and comprehensive approach that takes into account the individual's symptoms, medical history, and overall health. With a confirmed diagnosis, the next step is treatment. Tuberculosis is a serious disease, but it's not untreatable. So, how do we combat it? Well, the mainstay of tuberculosis treatment is a course of antibiotics. This isn't your standard week-long course though. To effectively treat tuberculosis, these antibiotics must be taken for a whopping 6 months or more. This may seem like a long time, but remember, tuberculosis bacteria are tough customers. They grow slowly and are adept at hiding in your body, which is why a prolonged treatment period is necessary to ensure all the bacteria are eliminated. The most common medications used are isoniazid, rifampin, ethambutol, and pyrazinamide. This cocktail of antibiotics is often referred to as first-line treatment. These drugs work together to kill the bacteria and prevent the disease from coming back. Now, it's crucial to underline the importance of adhering strictly to the prescribed medication regimen. Why, you may ask? Well, if the full course of treatment isn't followed, some bacteria may survive, and these survivors could develop resistance to the antibiotics. This can lead to a form of the disease called multi-drug resistant tuberculosis, which is much harder to treat. If first-line treatment is ineffective, or if the patient has a strain of tuberculosis resistant to these drugs, second-line drugs are used. These include medications like fluoroquinolones and injectable drugs such as amikacin or capreomycin. However, these drugs tend to have more side effects and are used only when absolutely necessary. Alongside medication, supportive treatment like a healthy diet and adequate rest can also play a pivotal role in recovery. It's also important to minimize contact with others, especially during the initial weeks of treatment, to prevent the spread of the disease. Remember, tuberculosis treatment isn't a sprint, it's a marathon. It requires a commitment to follow the treatment plan meticulously. It may be a long journey, but with the right medical care, regular checkups, and a dash of patience, it's a winnable battle. Treating tuberculosis is a long journey, but with the right medical care, it's a winnable battle. So, we've learned quite a bit about tuberculosis today. Let's summarize our key points. Firstly, we dove into the mystery of tuberculosis, a disease that's been with us for thousands of years. It's an infectious disease caused by the bacterium Mycobacterium tuberculosis. Primarily affecting the lungs, it can also strike other parts of the body. We then uncovered how tuberculosis spreads. It's an airborne disease, transmitted when an infected person coughs, sneezes, speaks, or sings. The bacteria are propelled into the air, and people nearby may inhale these tiny droplets, leading to infection. This makes understanding the dynamics of its spread crucial for prevention and control. Symptoms of tuberculosis were our next point of interest. They are often subtle and may be dismissed as a persistent cough or fatigue. Other indicators include chest pain, loss of appetite, weight loss, and night sweats. It's essential to be vigilant as these symptoms can easily be mistaken for less severe illnesses. We also explored diagnosing tuberculosis. It includes a skin test, a blood test, and imaging tests like X-rays or CT scans. The diagnosis is confirmed by laboratory tests on sputum or tissue samples. Early detection plays a significant role in effectively managing the disease. Our journey took us to treatment options for tuberculosis next. The good news is, it's curable and preventable. The primary treatment is a course of several antibiotics taken for 6 to 9 months. The key here is compliance. Completing the full course of medication is vital to prevent relapse and resistance. In conclusion, tuberculosis is a significant global health issue, but with awareness and early detection, we can combat this ancient adversary. It's critical to remember that anyone can contract tuberculosis, and it's not a reflection of personal cleanliness or moral character. Remember, knowledge is power. Stay informed, stay healthy.